Good evening, everybody. Good evening. I apologize for my tardiness. I want to acknowledge Commissioner Miller. Where are you? There we are. And Commissioner Degnen, who have joined us. Thank you so much. And of course, you'll hear from Israel Rocha, our CEO, in a bit as well. So I'd like to thank the members of the Cook County Board of Commissioners and the Cook County Board of Health who are with us here tonight. I'd also like to recognize Cook County Health CEO Israel Rocha and Chief Strategy Officer Andrea Gibson, who with their colleagues put so much thought and energy into the health system's 3-year strategic plan. I also want to thank all of you in this room, our invaluable community partners. You provided input during the planning process, and you're here tonight to learn more and share input about the final plan. Your support is essential to the future of our health system, and I want to thank you. Cook County Health's success is critical to the well-being of our residents in Cook County. The health system provides essential care and services, primary and specialty and subspecialty care, emergency and trauma care, behavioral health care, and substance abuse treatment. Cook County Health provides care for patients at the Cook County Jail and the Juvenile Temporary Detention Center. It serves as our suburban public health authority through the Cook County Department of Public Health and operates County Care, the largest Medicaid managed care plan in Cook County. Last year, Cook County Health served more than 200,000 unique patients, provided health coverage for over 430,000 members, filled 4 million prescriptions, administered its 1 millionth COVID-19 vaccine dose, and provided 30,000 intake screenings at Cook County Jail. I've committed that equity will serve as the guiding principle for all our countywide efforts so we can create transformational change and disrupt historic inequities. And that's exactly what Cook County Health's strategic plan was created to achieve. I'm grateful to for the work of Cook County Health team in putting together this plan, which prioritizes equity initiatives, is fiscally sound, and positions the healthcare system for future success and sustainability. Getting your feedback is important to ensure we're meeting the needs of the residents we serve. We're grateful for your support of our 3-year strategic plan and look forward to your participation in bringing it to fruition. So, thank you all, and now I'd like to turn the program over to Israel. Again, apologies for my tardiness.
So I think also to share a few words with us is Commissioner Miller. So, Commissioner Miller.
Thank you, Chairman, and good evening, everyone. I'm Cook County Commissioner Donna Miller, and I'm just glad to be here to hear the vision moving forward for Cook County Health. It's been great to see the partnership that the county board has had with the Cook County Health and Hospital System under the leadership of Israel Rocha and President Preckwinkle. As we all know, healthcare disparities are such an issue and such a focus here in Cook County and beyond in our entire nation, and we're fortunate to have a health system focused on addressing those inequities and healthcare disparities for the communities that we serve, and I'm proud to serve on a board that focuses on that. So thank you for having me.
And next we have Commissioner Degnen.
Thank you, Israel, and thank you to Cook County Board President Tony Preckwinkle, and thank you for all for being here. My name is Bridget Degnen. I am a County Commissioner of the 12th District, which covers much of Chicago's north and northwest side. So I am in no way a healthcare expert, but what I am good at is listening. And what I've seen over the last 4 years of my first term in office is that the people that are embedded in this health system and your leadership here are so fully committed to ensuring that not just the vulnerable and the most vulnerable in our communities have their healthcare needs met. It's that anybody that comes through this health system is cared for with compassion, no matter if it is a physical or mental health issue. Combining those two things together and ensuring that all of our communities are supported ensures that not only are people healthy in a mental and physical way, but they can go to work, they can care for their children, they can care for their friends and neighbors in a meaningful way. And so as a county board commissioner, I know that I speak for Donna Miller and myself and for our entire board to say that we are here to support you. We are here to listen to you, and that if you need anything, we have open arms, open doors, and open hearts. So thank you for having me here tonight, and I look forward to hearing more. Thank you.
Thank you, everyone, for joining us tonight. As I said, my name is Israel Rocha, and I'm the CEO for Cook County Health. I want to start by thanking Madam President for your continuous support. You have been a stalwart advocate of health care for all, have continued to elevate our health equity and justice as a priority across your administration, and a call that we create a health system that is responsive, effective, and transparent to our community. Your leadership has been an integral part of helping us to advance the success of Cook County Health and is responsible for what we have achieved along with our care team. While we set our sights onto the higher future, it is your continuous support and that of our commissioners and our board members and the community that allows us to do so. I would also like to thank the Cook County Board of Commissioners who are here with us and say a few words. We have Commissioner Miller, Commissioner Degnen, and also want to thank our chairman who couldn't be here with us today for the Health and Hospitals Committee, Commissioner Deere. Also want to be able to say thanks to our healthcare member, to our Cook County Healthcare Board of Directors members, including Chair Lyndon Taylor, Director Otis Story, who's with us, and Director Jay Bott, who's also with us today. Could all the members who are here with us from our Cook County Board or Commissioners please rise so that we can give them a round of applause? So please. Our Commissioners. Thank you. And Director Story's in the back. He's standing already, so thank you. Also wanted to be able to thank you for your leadership. As our leadership and our governance teams, you help us to ensure that we're running a strong system, and you hold us accountable for what we do for our patients, what we do for our system, and the trust that our community has placed in us through you. It is our sincere thanks and gratitude to also our Chief Strategy Officer, Andrea Gibson, for her efforts in helping to get us all together on our strategic plan. And to coordinate our leadership team and all of our staff who contributed to the development of the plan that we'll share today. Our staff are what make Cook County Health exceptional. I've always said that a hospital is a building without our staff. It takes our staff and our team and those who bring it to life to become a hospital and a place of healing. And so we always want to thank the exceptional work of the Cook County team who makes our healthcare institution possible and makes the art of healing a reality. If you are a member of the Cook County Health Team, will you please stand to be recognized for your extraordinary work? So please stand. I see many of you here. And finally, I would like to acknowledge everyone in the room tonight. It is a partnership that allows a public hospital to take place. And over the last few years, and maybe over the last few tens of years, we have seen public health systems start to become less present in communities. But they are critically important because they ensure that everyone has equitable access to health care. And here at Cook County, we're wanting to make that equity be a reality, that it's not just access that we pursue, but the delivery of world-class health for everybody who needs it. And that's our goal, is to make sure that if you need any advancement, any treatment, any modality, that it is available to you, regardless of your ability to pay and regardless of where you come from. You simply have to be here at our institution, and we're going to care for you. And that is a mission that continues on to this day, and it could not be possible without your support. As our community, you're the reason that we exist, and it is your trust and your partnership in our institution that allows us to be here, and we honor your trust in us and are humbled by that. And so thank you for joining us tonight to help build a better hospital. Also, we are thrilled to be here to share what we have in mind for the future, our goals, what we hope to achieve. Again, one of the requirements from President Preckwinkle is that we make sure that we create a transparent organization, one that you can each be a part of. And when we were going out and meeting with the community for the development of this plan, one of the things that was said, continuously to us is that you wanted to be involved, you wanted to be part of it. And so we're going to have more community forums like today. Hopefully, maybe not as long; they'll be a little bit more short. But today's an important one, so we wanted to take a little bit of your time to share where we're going, so that we could have back your comments, your thoughts, and how we can continue to refine our organization. So we're thrilled to be here. The plan that Cook County Health has put forward, we believe, will help us to continue to meet our mission of making healthcare a human right, to continue to transform our organization. And now I want to share a few words in Spanish for our Spanish-speaking guests. Gracias a todos por venir esta noche. Estoy encantado de hablar con ustedes sobre nuestro plan estratégico de 3 años. Este plan ayudará a Cook County Health a seguir transformándose para podamos cumplir nuestra misión y servir nuestras comunidades. Su apoyo es fundamental para nuestro éxito y la salud de nuestros residentes del condado de Cook. Gracias a todos por estar aquí con nosotros esta noche. Your support is essential to the success of our health of an organization, the delivery of health for our Cook County residents, and for your ability to be here tonight. So tonight, I'm going to tell you a little bit about what you're going to hear. So thankfully, you're not going to just hear from me for the next 45 minutes, but we have been able to invite you into our organization. And because healthcare is a little difficult, we can't always have you come into our area, especially now in an era of COVID, while we are doing better. So what we have done is that throughout each of our pillars, we're going to be sharing some videos with you. Videos that are our patients talking to you directly about what our care has meant and what it means for us to be working together as a public entity. So we'll talk a little about each of our pillars, what we hope to accomplish, how they drive our organization. You'll hear from them and a little bit about our future. So our first video will give you an overall presentation about what Cook County has been able to accomplish this year. Andrea?
For nearly 200 years, Cook County Health has stood as a beacon of hope and health, where everyone can get care regardless of their ability to pay, their immigration status, or their race. From our humble beginning as a small almshouse to today as a multi-campus, $4 billion health system, Cook County Health has a long and rich history of service and innovation. We have seen unprecedented changes in healthcare, from shifts in the healthcare delivery system to new health coverage options to the COVID-19 pandemic. We have always advanced with the times, and that evolution continues today. We have built new health centers in Blue Island, North Riverside, and Belmont Cregan. We made significant investments to Provident Hospital and are now welcoming back ambulances to help ensure access to emergent care on Chicago's South Side. We have been at the forefront of the COVID-19 response, caring for thousands of COVID patients and administering more than 1 million doses of the vaccine. County Care, our top-rated Medicaid health plan, has record-breaking membership, providing health coverage for more than 400,000 Cook County residents. We have explored new ways to serve our communities as a public health authority, and we tackled the monkeypox outbreak by providing vaccines, testing, and treatment. We served more than 3,000 asylum seekers, providing the ongoing healthcare services they need to start their new life in the United States. With a focus on equity, we established the Change Institute of Cook County Health, all while we continued to provide high-quality, patient-centered care to 230,000 individuals at our hospitals and health centers. With a new 3-year strategic plan in hand, we stand poised to lead Cook County Health confidently into the future. The goal, ensuring access to high-quality care for all as a provider of choice, and upholding our essential role in education, discovery, and innovation across the industry. Our success will be built on the 7 strategic pillars that guide our work. Over the next 3 years, we will work towards concrete goals of expanding service lines such as neurosciences, cardiovascular, and oncology, investing in essential facilities like Stroger and Provident hospitals, enhancing the county care provider network, and creating a roadmap to maximize our public health impact. We will develop and coordinate a continuum of behavioral healthcare services that extend to our outpatient health centers, to our hospitals, and to our correctional health facilities. We will continue to build our mission-driven team, and with their expertise and dedication, we will achieve key benchmarks in care quality and patient experience.
I think the most exciting thing for Cook County Health right now is our future and where we're going. We have a tremendous opportunity in front of us. Every day we stretch out to increase our network, to enhance our footprint, and we're taking bold steps to create new opportunities, new facilities to keep the promise of what Cook County Health means for our community.
Our transformation continues. With the support of our dedicated team, our patients, and the communities we serve, Cook County Health is charting our path forward to equity and excellence. Together, we are achieving great things. As one Cook County Health.
So that's a little bit about what we have been able to accomplish together. One of the first things that we did in our strategic plan was to reimagine our mission and our vision. Cook County Health has accomplished something that few organizations get to do, and in our almost 200-year history, we're very excited to have been able to do that. Our first mission really was aligned with providing with providing care, and so it said that we're going to make sure that we provide care to everyone who was needing care and assistance. As healthcare is changing, we have a new mission, and it's not just to provide care to those in front of us, but to provide healthcare access to everyone who needs it. And that is a new challenge, because as we have been able to grow as a community and are so thankful for the work that has been accomplished by the individuals in this room, both our community members, our care team members, and everyone in between, Illinois now stands at a very, very proud forefront to be one of the first states in the country to be able to provide almost universal access, including to those who are undocumented. And that took the work of so many people working together collaboratively to make that happen. But while we have been able to create more care, and that is the first step, we have not created more providers, and we haven't really created more institutions to meet that new demand that will be coming forward. So our mission becomes a little bit different, but equally vital as it has been in the past, is to ensure that that access continues, that we continue to grow our systems, to grow our ability, and to ensure that everyone has access to the highest caliber of medicine, regardless of your ability to pay. So our previous mission really talked more about providing care. Now we're talking about providing access to ensure that whoever needs care, no matter the level, no matter the complexity, no matter the effort that it takes to be able to build that health care, that we will be here. That Cook County Health will set a measure equal to the accomplishments that have been made by our community in helping to create those coverage programs. We need to be here to be able to create that advanced ability for people to have access to it. And so our new mission is to establish universal access to the world's best care and health services for all of Cook County residents, regardless of their ability to pay, so that all may live their healthiest life. And of course, we're a very complex system. As you heard the president talk about, we have an amazing public health department that serves our suburban Cook County residents. We have a correctional health department that is one of the largest in the country. We have an acute care division with Stroger and Providence hospitals. We have a large ambulatory care network with 13 locations. And we have a managed care plan with County Care, and then continue to serve almost over 450,000 patients. And so much other things that comprise us. So it's not just direct care, which we want to do completely through our system, but it's also health services and what we can do to be a partner with the community. And so we believe that this mission encompasses of where we're going to the future, and it's slightly revised because we had an ability to say, we now provide excellent care, and that mission has been met, and now we want to make sure that we strive forward to create access to the world's best medicine for everyone through our institution. Our vision also has changed. It's what we strive for the future, why we're here, and our goal is to ensure that health is a human right. We fully believe that you cannot enjoy all of your civil liberties and everything that is entitled to you if you're not healthy. And so there is probably no greater meaning or purpose that we can do is than to ensure that health is a human right, something that is attainable, achievable, and unabridgable to all of the individuals who reside in our county. And when we have challenges, questions, and we're growing our institution, what we build, we have a set of values. And so we added a set of values to remind our staff. You know, the beautiful thing about healthcare is there is a protocol and a rule for almost everything. But even then, despite all of our thousands of policies and rules that we have, there are times where staff must use judgment. And it's times where we as an institution must be guided by what we believe in. And those are our values, and they're best symbolized by I care. We believe in innovation, in compassion, in accountability, in respect, and in excellence in education, and that will drive our care, that we have to work together. Here are our strategic pillars. You can see there are 7 of them. In a minute, we're going to go after each one, but they span the globe from being able to provide care to ensuring the workforce and teams that accomplish it, to our patient experience that drives it, our organization and how we optimize, and our growth and innovation. We'll go a little bit about what each one means. Our first pillar that we're going to review tonight is patient safety, clinical excellence, and quality. We recently had a poll that we build our organizations, and we asked our residents and the individuals who use our services the most, and we looked at the patients and said, who is most like the patients we serve, because we had a large cross-section. Overwhelmingly, when they were asked, what is the one thing that you want your health system to do? And they said they want to deliver excellent care. They want to make sure that they have an ability to go, and they want to have that service to be at the highest caliber possible. And so that's what we're wanting to make sure that we aim for in our organization. So our goal, our first pillar, is patient safety, clinical excellence, and quality. And its goal is to ensure the highest quality service, the best clinical outcomes by providing patients the right care at the right time in the right place. And what that means today, we're going to start with another little video so you can take a break from me speaking, that actually has a reflection from our providers and our patients about what we have accomplished in those areas and how we're pushing forward the ability to deliver clinical excellence through our overall system of care. Andrea?
Cook County Health is proud to provide the latest in procedures and advancements in care to our patients. Our historic mission means we believe that everyone deserves access to high-quality care regardless of their circumstances.
I think Cook County is very uniquely positioned. It's one of the only few safety net hospitals in the country of United States that is able to offer this advanced procedure called TAVR. We are able to offer this to any patient walking into our doors, irrespective of their ability to pay. We are bridging the disparity in healthcare that we see in Cook County every day. TAVR stands for transcatheter aortic valve implantation or replacement. The procedure is a minimally invasive procedure in which we replace a diseased valve with a functioning valve in a beating heart. It's a procedure done under general anesthesia, but it's minimally invasive so the patients are able to quickly return to their activities and are able to go home within 48 hours.
I could probably walk a half a block without having to stop, and it was like a acid reflex burning in my chest. All this was just burning like it was on fire, and I couldn't walk.
Miss Jones, when she came to us, was so symptomatic that she was not able to do any of her activities on her own.
I'm able to do the things I was doing prior to me feeling so, weak and tired and no energy to go anywhere. Now I get up, do what I have to do, go home and enjoy being at home, and I'm just loving it. It truly feels great. It really does.
Being able to provide this type of care to our patients exemplifies the work Cook County Health is doing to ensure our patients can live their fullest life.
If I could say one thing to Dr. Zaney, that's thank you. Thank you very, very much. I truly mean that.
And I think in the words of our patients, what we hope to accomplish here at Cook County Health through clinical excellence is helping people live their healthiest life. It really is creating and designing procedures that are responsive to what the individuals need, what our patients are needing. And so TAVR is something that we're very proud of. It's one of our developments under our program called our clinical service lines, which we have helped to enhance our services to coalesce them in larger institutes so that you have an easier time being able to go through our hospital and our health system. One of the challenges about healthcare that we have today is that sometimes you have to go many places. You have to go to your primary care doctor, then you have to go for tests, then you go for a cardiologist, then you get sent back, then you have a cardio specialist that needs to see it, a cardiothoracic surgeon who needs to be able to see what you need to do, or a proceduralist, and then you have to get sent back. And you have this game of going back and forth. One of the things we're trying to do through our service line, and you'll hear that word quite a bit, and what we're trying to accomplish is to bring it together, to make it easier for you, so that maybe you can come in one visit, get through a series of things that you need. We're also going to be talking about some things later on in the presentation that will utilize technology. Our goal is to not only be here to offer the world's best medicine, but to make it easier, to recognize that our patients have struggles, and that one of the things that we can do as a healthcare provider is make it easier. And so part of why TAVR is impressive is because it's a procedure that does minimally invasive surgery. You don't have to have an open heart surgery. Sometimes it can be done minimally invasive, and you can get full restoration of what you didn't used to have, and you can go back to your life and have done it in a very short turnover time. And so it makes people more encouraged to do what they need to do to live their healthiest life. And so that's what we want to be able to restructure our services. So under patient service and clinical excellence, in the future, what we're going to be doing is continuing the development of our subspecialty service lines, building large institutes around cardiology, oncology, neurosciences, and being able to move forward in orthopedics to make sure that the things that you need, that you can do, and how you can live healthier are part of what we can do, so that we make it easier for you to come in, get what you need, and go out, and make sure that we're also not just delivering the care that you need, but evolving its science, looking at its research, pushing forward with procedures, and ensuring that we're here for our patients at the highest level of caliber care that we can provide. We're also going to be looking at things to progress our pathway to becoming a magnet hospital for our nursing program. One of the beautiful things about Magnet is it empowers and restructures a hospital where everyone has a voice. So each of our clinical divisions, our unit councils, our doctors, our nurses, they will all be working to be able to work in collaboration to build a stronger institute together. And there's many more, and we encourage you to read them today, but I know we have a set amount of time and 7 pillars to get through. We just got through one. So I want to make sure that we're moving forward, encourage you to read it, but it's about building success. Next, our issue is to make sure that we have health equity, community health, and integration. Because what equity means is that we're providing care for you on your level and at what you need. We all have different lives, whether you're a busy executive who can't come in to see individuals, or you're a busy executive in your home, taking care of your family, and you're the only provider and taking care of many people who rely on you, that you don't have time to come in and see appointments. How do we make that easier? How do we make those accessible? Or you don't have the resources to recover and get healthy, or you are right now having a problem with your housing situation and home, and you need a procedure that needs a home to recover. How do we do that for you? Or you don't have the resources to eat, and we need to make sure that you're having a healthy diet. What do we do to be able to be there for you as a healthcare organization? So equity for us means being able to ensure that the benefits of medicine work for you in the very special, tailored way for what you need, and creating those just spaces. So our goal is to create just spaces where patients and communities' comprehensive health needs are fully met and guide the development of their care. And for that, we'll also have you hear from our team and what they're accomplishing, what they've accomplished this year.
In our ongoing effort to ensure that we're providing equitable health care, it has been important to address social risk factors that impact that. Of course, those social risk factors include everything from transportation, food insecurity, but we have really focused by way of the Respite Center on housing insecurity. The RISE Center has created a unique opportunity to go beyond just healthcare in the four walls of the hospital.
The purpose of medical respite is to find temporary housing for people that are recuperating from medical procedures or illnesses. They come here so that they can have a place to rest and recuperate and get wraparound services. That includes nurses, medical assistants, and case managers to not only help them with their medical issues, but also to help them procure stable housing.
To imagine being discharged from a hospital after an acute illness without people who care about you, without transportation to be able to make it to outpatient appointments, without adequate food and clothing, and without a roof over your head. It's pretty intuitive what a challenging experience that could be.
I've been homeless since 2010. My mom passed away, things just basically fell apart for me. And this has been a blessing, it really has. I've been able to reconnect with my family, my daughter, my sister, and they've been there for me. Excuse me. I've been able to regain my health. You know, it's not to full capacity yet, but I'm getting there. This is the place that saved my life. It's that simple.
So with this program, we have been able to provide over 98,000 pounds of foods for patients in need. We also worked quickly to be able to create an asylum health center, one of the first of its kind anywhere in the country that provided its full clinical and medical needs to our community and provided over 4,000 individuals. And this is important because it not only helps the asylees who were greeted into our community, but also helps ensure that we are treating individuals for communicable illness, for other screenings that they have, getting them ready for school physicals, and ensuring that everyone is safe and has all the services that they need. We also were able to use the full expanse of our service, and our Cook County Department of Public Health created an Enhanced Health Atlas program, bringing together for the first time in partnership with the University of Illinois Chicago and the Chicago Department of Public Health an integrated health atlas. It lets us know where we're having those challenges, where we need to put our investments, and how we can drive equity in our community. And then with our county care plan, we housed over 53 members in flexible housing pools and are hoping to double that in the coming year. And so what we hope to make sure that everyone sees is that we are committed to equity and to creating just health care. And that means that a healthcare system where everybody gets what they need to be able to live their healthiest life, and that they are assisted in their journey of providing health and moving forward into the future together with the support of one health system, and that being Cook County Health. Next, we want to talk a little bit about our accomplishments and what we have continued to do. And we're going to talk a little bit about this also in what we do across for our fiscal resilience. Cook County Health has the pleasure of saying that we provide 44% of all charity care in the county. That's of all hospitals. Cook County Health alone, with our 2 facilities of Strozier and Provident, and also our 13 ACHN centers, provide almost 44% of our charity care. That is because part of what health equity means and how we have this outsourced presence is that we're one of the few institutions that provides all services regardless of your ability to pay. EMTALA ensures that individuals will, when they have an emergency, will be treated at hospitals. But elective surgery, elective processes, things where implants can run $40,000, $60,000, $100,000 are not always afforded to everyone if you're not insured. And here at Cook County Health, we do not make a distinction between those with medical coverage and those without. If you need the service, we provide it. If we don't offer it, we get it for you, including working with partners to be able to get rehab services, extended services. I look at Dr. Fegan because often we sign these agreements every day to be able to place people in other institutions, and they run through us to ensure that there is one standard of care here at Cook County, and that will be the highest standard possible. And if we don't have it, we'll get it. And we tell everyone, and please share this message, if you have any questions about how you can live your healthiest life, simply come to Cook County Health, and we will make sure that we're your partner in helping to achieve that. And that brings us to our next pillar, which is our patient experience. So our patient experience, our goal is to develop systems of care, education, to provide for an empowered patient experience, which is also very much a part of equity. We want to make sure that everyone is an active participant in their journey, and that healthcare is a partnership, and we build those processes together.
Cook County Health is proud to have a diverse workforce that lives in and is reflective of the communities we serve. As we continue to build our expert team, we are finding creative ways to recruit top talent in a competitive job market. Over the past year, Cook County Health has held nearly 20 large-scale job fairs. And to compete with other health systems, we are offering recruiting bonuses for select positions. These strategies have led to over 100 external hires who have joined Cook County Health, where the recruiting bonuses have been applied, in addition to an increased number of external hires month after month. We're very proud of this accomplishment.
We are committed to making Cook County Health an employer of choice. We also want to make sure we are looking forward to future generations.
In 2022, with support from the Cook County Health Foundation and Cook County government, we launched the Provident Hospital Scholarship Fund, which is now providing financial assistance to over 30 students pursuing educational paths in the medical and dental fields from underserved communities.
It's essential that we lift up students, such as you in this room, and that you lend your talents to underserved communities. It's the right thing to do for the nation's healthcare workforce, and the right thing to do for our Cook County Health patients.
We will continue to recruit to ensure diverse staff who reflect the patients we serve. Doing so also allows us to provide culturally competent and high-quality care.
And what we're so pleased about is that this came to light in working with our patients. What we have done over the past year is to create patient family advisory councils at each of our locations to make sure that what we're doing and how we're being able to advance our services is fully then met and seen through the lens of our patients. Because oftentimes we may think that we're doing great things, and then we learn that maybe that didn't go over the way that we thought, and we need to readjust, or we need to rechange, or our care teams may be so insistent on making sure we're meeting the rubric of care, but may miss some opportunities to engage and educate and what we can do to do better. And that coming together, our patients, their needs, our providers, and the exceptional care that our team provides is what being committed to our patient satisfaction is about, and we have seen that as a big improvement. We've gone from 51% to 67% in our overall patient experience at our acute care centers, and our county care plan has done amazingly well by earning top ratings nationally under Rate the Specialist, Customer Service, and Rating of the Health Plan for pediatric and adult categories. And so no matter our modality, providing direct care, the care plans that we build, or ensuring our processes and programs through our public health department, we are working to improve these initiatives across the board. Going forward, we hope to be able to expand our care management and patient engagement and patient services so that you have more support when you need it, that when you leave the hospital. Nothing is more alarming than when you've been in a health system, your life has completely changed, and now you need to step into that new life, and maybe you may need help maneuvering. Maybe you don't walk the same. Maybe you can't do what you used to do because you had an implant, and what that means, what that feels like. We need to make sure that you have the services you need to be successful. And so we're working to do that. One of the things that we'll also be doing is to continue on our financial counseling to ensure that everybody has the new coverage resources that are available, and that we're making sure that everyone is able to improve their communication with our patients. And part of that is something that you'll be hearing called our One Source Enterprise, which is something we're very excited about. It's how we're going to bring technology into the 21st century, where a public safety net system, and excited to almost say the 22nd century, but we'll see, but being able to bring in technology where you no longer have to just come into a facility when you're feeling sick. Maybe there are easy ways to get you doctors, to get you in touch with nurses, to renew your prescriptions, to make it easier for you to do it in your house, to do it 24/7 by going to a location where we have 24-hour nurses to draw your blood, and then when you see someone online, they have all your blood work in front of you, so they can actually make actionable decisions. That's how we're looking to revitalize patient experience, is to change the one thing in healthcare that we don't think has changed enough, and that is the front door to healthcare. We have done amazing work advancing the technology, but if you think about it today, the way you access healthcare is still the same way. You have to find a doctor. You have to ensure they have your health plan. You may have to wait weeks for the doctor to have an availability, and then you start your healthcare journey. Our goal is to put the easier things up front so that when you see that doctor, you're able to make immediate decisions about what you can do to be healthier. And that's what's going to be our mission, is to make Cook County Health a public health system that is reinventing the way that people can get access to that clinical service, to make it easier, to make it round the clock, so that eventually, maybe in the future, we're not quite there yet, but it'll be as easy. I always say I want to make healthcare, and it makes sometimes doctors nervous, but I want to make healthcare as easy as going to a fast food restaurant. No matter what we say about fast food, may be unhealthy, it is used because it is convenient. You've all had your long day at work, you're tired, and we all just go through because it's easy. And so I want to make healthcare that easy. And we can drive through and we can do what we need to do to be able to drive forward our healthcare plans and our solutions and to move that forward. So while we're not quite there yet, we hope to get there in the future. Next, we're going to talk about our workforce and our Teams and Talents program. And that is it. We've always said we're nothing if we're not being able to have an empowered team that is here to provide care. And so for that, our goal under our healthcare pillar is to serve as the employer of choice by supporting and investing in our workforce and recruiting the best talent and fostering robust teamwork. As a government-sponsored health system, it is essential that we operate efficiently in order to serve as many people as possible. The allocation of taxpayer funds to Cook County Health overwhelmingly supports our public health department, the provision of correctional health, the modernization of our facilities, and expansion of our services. I am proud that our health system is largely financially self-sustaining, and we have ended recent years with a positive operating margin. We have improved our cash collections as part of our revenue cycle turnaround plan. The payments we were able to collect help us fund our CareLink program that provides free or discounted care to patients in need.
Yo decía, ¿cómo voy a tener un doctor si no tengo un seguro médico? Entonces, con este programa, con esta ayuda, es como si yo me siento que lo tengo todo. Tengo doctor de cabecera. También he tenido más problemas de salud y la verdad como que fue una ayuda, como que si Dios puso ese programa en mi camino, porque he tenido que estar visitando al hospital y todo me lo ha cubrido.
Our two hospitals provide nearly half of all the charity care provided by all hospitals in Cook County. Our ability to be fiscally resilient ensures that we can continue to care for all, regardless of ability to pay, and remain an essential community asset.
So at Cook County Health, our job is to make sure that we bring the best talent. And we're not waiting until you become a member of our care team. As you heard the president talk about, we have started an aggressive scholarship program that gives up to $20,000 per student from the undergraduate level all the way through medical school completion per year, that allows you to then recompete for that scholarship. So someone today who was entering their first year as a freshman can now almost have their entire coursework paid for from start of the first year all the way through their fourth year of medical school, thanks to the new Providence Scholarship Fund that was designed. This is a revolutionary feat for what we can do to move forward. And we had 30 where we're starting, and we hope to grow that, as the president has requested, up to 60 in this coming year, and we hope to do even more into the future. That's a partnership that we're working to build together. And for those of you who are listening, want to be part of the Cook County Health team, we offer robust services. We're one of the last places where you have a pension, and trust me, now that that 50 is becoming a much closer number for me, I have never realized how important a pension is until you're getting ready to retire. And so we may not think of it going into the field, but it is something very important as you're looking in the middle of your field or as you're reaching the end of your retirement. And we offer also something tremendous for our nurses, who says that regardless of what you want to study or where you study, if it is connected to nursing, we pay your full tuition to any school, university, or program of your choice. That is something that is truly extraordinary, unlike any other institution I have ever seen that has been created to be able to attract the most talented, robust nursing workforce that we have. Over the year, you've heard we've expanded our job programs, we've expanded development, we've had sign-on bonuses, we have retention programs that are underway, and so we hope to continue to build a vibrant health team into the future, and are acknowledging that as we all work through it as a healthcare industry, when we're seeing the great retirement more than anything else, and we see people wanting and limitations about having enough providers coming into the field, not because we don't have enough, but we're growing. Our population has grown, and we've relied a lot on our generation who has given over 20 years of service, and now they're coming to retirement. So we need to build a brand new one. So for those individuals interested in coming to healthcare, the field is open and leadership opportunities are available, and it's time to join now. So please heed our call, join Cook County Health, and you'll have an amazing experience going forward. And we cannot do that, and we always say, people will ask, as a public institution, should fiscal resilience be one of our pillars? And fiscal resilience is essential, because fiscal resilience allows us to complete our mission. If we do not have a margin, we cannot build into our mission. The beautiful thing is that here at Cook County Health, because we're a public institution, when we do well and we operate, we're able to re-put that investment back into our facilities, into our programs, into developing new processes. So we have probably even a larger mandate to ensure that we're fiscally resilient, so that we're here for another 200 years and are able to celebrate Cook County Health's 400th birthday. I don't think I'll be here for that, but definitely want to make sure that that happens. And so we want to make sure that we're able to accomplish that, and that means that we have to maintain our processes in a resilient way. So one of our pillars is to ensure that Cook County Health's finances enable the expansion of our mission. Cook County Health's goal is to be a provider of choice. Enhancing our facilities is one part of our larger strategy to provide high-quality, patient-centered care in the neighborhoods where our patients live and work. As more and more patients get health coverage, they have new options for care, and we hope that they will choose Cook County Health.
We are committed to modernized facilities to ensure that each one of our patients, regardless of who they are, what they look like, what zip code they live in, what language they speak, receive the highest quality care.
Modern and bright healthcare facilities can improve patient flow, foster trust, and trigger endorphins, which reduce anxiety. They create an overall positive experience that helps improve clinical outcomes.
Each one of our modernized facilities is a patient-centered medical home. What that means is every one of our patients is welcomed. We define that welcome in the facility by how it looks, the colors that we put, community murals that we put on the walls. All of that creates an ambiance of making a patient feel welcome.
It is an honor and a privilege to serve our patients, and we are continuing to make investments in our facilities to ensure that they match the high caliber of care we provide. You know, a quick little side note. I didn't know what they were going to be using all those video clips for when they gave me. I think they thought I could get stage fright when I came up here. So they wanted to make sure that happened, they could play the video, just a side note. So very happy that has worked out well. But really what we want to do is that we're very proud to have a balanced budget for FY23 and to have posted a positive operating margin for FY22. And it shows that we're able to do when we work together as a community, that we can build the services that we need, we can make the investments in our organization, and we can ensure that we're planning for the future by being able to build the best, strongest system possible. So we're happy with our team, and of course our goal is to maintain a positive operating margin in the future to come and to ensure that we're able to do that by enhancing our operations, ensuring that everyone gets coverage that they're entitled to, and ensuring that our CareLink program continues to thrive in the future to provide more resources for individuals who need care, who may not have the ability to be able to get there on their own. Our next pillar is our optimization, systemization, and performance improvement pillar. This talks about optimizing our systems to ensure they're accessible, reliable, appropriate, effective, standardized, and resilient. Our goal, and how we have been able to get here for almost 200 years, is ensuring that our processes are always able to be taken up by the next generation, that we're doing everything efficiently, that we're doing everything in a way that is driving forward the standard of care in medicine. And so this pillar allows us to make sure that when you come into Cook County Health, we are offering you the best services and the most efficient and the best standards possible.
When COVID-19 vaccines became available, Cook County Health knew immediately we would need to find a way to provide large-scale access to vaccines, not just for our patients, but for Cook County as a whole.
But we promised every resident who wanted a vaccine would be able to get one, and that special attention would be given to be sure that we reached our most vulnerable residents. I'm very proud to say that we fulfilled that promise. Reaching this milestone is a testament to the faith and trust residents have in Cook County Health and in science more broadly.
We are committed to a program grounded in equitable distribution of the vaccine to ensure that our most vulnerable and the areas most impacted by COVID have access to the vaccine.
Setting up mass vaccination sites in central locations throughout Cook County took the work of an incredible team at the health system, from ambulatory to IT to pharmacy and beyond. It also included enormous support from our partners at Cook County government, the Illinois National Guard, and other government agencies and community partners. One major step in the vaccine distribution was the development of a website to provide information and appointment sign-up for residents. The day we launched, there were over 1 million hits to the website and 18,000 vaccine appointments made in the first week. We were also cognizant of the fact that we needed a call center to assist patients without computer access and offer support in multiple languages. With a focus on equity, CCH and the Cook County Department of Public Health hosted hundreds of hyper-local vaccine clinics to meet people where they were and created a public education campaign that has won more than a dozen awards. Cook County Health has given out more than 1 million doses of COVID vaccine and showed how effectively our health system can work together with our government and community partners.
So as you can see, even though we have been here for 200 years, we are still trying to be as modern and as nimble as we can be as an organization. And we have amazing partnerships. We talked about with our community, with our partners, but we also partnered with organizations like Amazon to create our website, knowing that may not be our best resource, and we couldn't fail when we launched one of the first websites in the country that allowed you to not only enroll, but actually enroll and get an appointment. A task that challenged many communities throughout the country. Where others failed, Cook County County Health succeeded because we brought in other partners. We were the first mass vaccination program to actually start administering vaccines in the country, and other communities and the federal government came in to look at what we did, to look into their programs and what they were developing and building for their future. So Cook County Health helped pave the way for a lot of processes that were being designed around the country. And that's really what optimization means, that what starts here at Cook County Health changes the world of healthcare, whether it's the world individually for you because you're the recipient of the care, or the world at large because we're helping to advance modalities in the practice of healthcare. And that's our goal, because you cannot truly be helping make health a human right if we're limiting it to only our location. Optimization and systemization ensures that what starts here through the great minds of our providers helps to change the world of medicine by being able to be replicated throughout the United States. Our goal is to not only simply deliver care, we want to lead healthcare into the future, and that's what we will accomplish through optimization and systemization. And we have amazing things that are helping us to guide that. We've been able to make sure that each of our service lines, our clinic divisions, have dashboards and rubrics in place that let us know, have full transparency when we're needing to make investments, when we're falling behind, where we can do more. We're taking advantage of reducing patient wait times by finding out and predicting who's going to show and who's not, and how we're going to be able to take advantage of those spaces so that people can wait less time. We're making sure that all of our ambulatory leaders and all of our care team leaders are trained in Lean and Six Sigma. We're implementing the latest techniques, borrowing from industries of the manufacturing industry, technology industry, and others to bring them into practice in healthcare so that we can all learn and develop a system that is better. And that goes across from direct care to even our processes by reducing clean times in our healthcare plan, as well as to going into the future to align our overall staffing models, to standardize our data, to ensure that we're being strategic with our objective and key results tracking platform that's going to ensure that this strategic plan continues to go into effect throughout our organization. And so with your help and improvement, it's what we hope to accomplish to make sure that what we do here at Cook County Health can be replicated throughout the country and become best practices. Our last pillar, and yes, our last pillar, we have made it together, so you will hopefully be done of me soon. But I have so enjoyed our conversation, and then it's a fun time. You can roast me a little bit with some questions. Just be a little gentle, please. But our last pillar, of course, is our growth, innovation, and transformation. No organization, especially in healthcare, can succeed into the future by not looking at what's about to come in the horizon, by not adjusting our locations to serve our patients. And as you've heard our Chief Experience Officer say in the video, it is our actual rubric and physical structures that can also help heal by being bright, vibrant, and opening up our organization to be what everyone seeks in healthcare, a place that you can call home. And that's really what our growth and innovation strategy is about. What can we do to ensure that our health system is a place that you can take that sigh of relief and that deep breath and say, I am home. And whatever is about to happen to me, I can handle because I'm at the place where I can heal. And that's what our goal is behind our growth and innovation transformation strategy. Our goal is to lead the journey to effective care, to better health outcomes through sound infrastructure and transformative access to care resources.
For nearly 200 years, Cook County Health has been evolving to meet the needs of our patients and communities, and we are continuing our evolution today.
Provident Hospital's roots go back to 1891, when it was opened as the first Black-owned and operated hospital in the country. While it has been through a lot since then, I am proud to say that we are rejuvenating this treasured, historic community hospital. In recent years, we have invested more than $8 million to modernize Provident. We upgraded our emergency department, expanded our med-surg beds, reopened the intensive care unit, installed a new MRI, opened a new outpatient dialysis center, and welcomed back ambulance runs. This year, we will be enhancing our surgical services and bringing on board more specialists to expand access to care right here on the South Side.
At Stroger Hospital, we opened a neuro ICU and a new 10-bed med-surg unit. There is a new clinical decision unit to help us monitor and quickly admit and discharge patients in observation. We are also doing a complete overhaul of our wayfinding system. Across the system, we are strengthening our behavioral health services and partnering with other providers to build more capacity. With a focus on access and equity, we are expanding our services to meet the health needs of people in the communities where they live.
So as you can see, our organization is growing and thriving to be the best healthcare institution that we can be, and across all of our modalities, from our correctional health division to our public health department, our county care plan, Strozier, Provident, and our 13 locations, we are every day looking to see what we can do better. And as we said, very soon, we will be talking about One Source Enterprise, which will be able to bring a new element and a new division to our organization that is part of what we have been doing with the Change Institute at Cook County Health, which is how we can reinvent medicine together. And so that will bring new organizations to a digital platform aspect of the delivery of healthcare. What we have done and what we grow is not just growing in buildings, but it's actually growing our healing power. As you heard Dr. Turner say in our video, we have restored ICU services in the South Side. That means more people are able to get intensive care services, to be able to be closer to home. When we found out that almost 70% of patients were leaving the South Side to have to travel outside of their community to get health care, we said that's something that needed to change. And together with this team, we've been able to accomplish that, to restore those services, to have another ED online where ambulances can take patients. And we're looking to continue that journey as we develop our mental health programs, as we look to launch new business development lines, as we look to expand our GI services and our outpatient services and our most advanced surgical services through our service lines. Cook County Health is looking to grow, to be able to be there for our patients in new ways, and to be able to deliver the power of healing across new modalities and new services. But we cannot do that without you, and we cannot do that without our health team and coming together as one organization. And that brings us to our closing remarks for today. And then as we talked about, the fun part of the questions, so please get your questions ready. I am very excited to have my team here because I will ask to phone a friend on occasion if I need my Cliff Notes, the best Cliff Note teams possible in real person. But what we want to be able to share with you is, first of all, thank you for coming into our home today, which is your home for healing. Thank you for helping us to build this organization. What Cook County Health stands for is striving to be great. We believe that probably in no other time than the time that we're living at right now has a public institution been more essential. Whether it was being at the forefront of responding to the COVID pandemic and creating new systems of care and strategies and innovations, being able to use modern airwaves and being able to take a marketing campaign to extend our doctors going into the living rooms of everyone and reminding them that it's okay to take a vaccine, that you can trust in the organization. And by the way, a marketing campaign that then changed the entire narrative across the country, including the federal government, on how people were talking about vaccines, and being able to bring that message to different communities started here at Cook County Health. Dr. Fegan was part of that with her message in the rooms that she gave. And that's part of what we want to be able to do, to continue to be the standard of medicine into the future. We believe that now more than ever, there needs to be a public voice in healthcare to ensure that no one is left behind, especially as we're having large gains be done through our organization. So now is the time for Cook County Health. What we hope to achieve, we know will be hard, but we will achieve what is great. Together, nothing can deter us. And we believe that by working together as we're doing tonight, by being able to have honest conversations, we know that we will not fail. Because together, Cook County Health, with its patients and our community and our public support, can accomplish anything. Even if it's having to have difficult conversations, we welcome them because we get better. So thank you for joining us today. Thank you for trusting us to be your healthcare provider. Thank you for giving us the support and ability to be great. And thank you for helping us to grow into the future. We're so honored and humbled to have your trust, to have your partnership here today, and to help us to continue to build a stronger Cook County Health into the future. Thank you so much. And before our questions, I would be in a lot of trouble with Andrea if I didn't ask what you could do to support us. So please read the Cook County Health Strategic Plan. Think about the key pillars and key initiatives and what you can do to help, how we can help your community, how we can help the community at large. Share your feedback and suggestions. In your bags, you have how you can join the Change Institute and the email. We will collect the cards on your way out and continue to partner and be collaborative with our organization. So now I think we're going to take some questions. So if you raise your hand, one of the members of our team will come over with a microphone, and I will do my best to answer. You have Alex in the back with a microphone. So if anyone has a question, please raise your hand.